May adlaw na tong tanan. If your wrist and hand is curled up after a stroke, you might want to watch this video. Hi, I'm Nathan. I'm your occupational therapist, and my goal is to help you be more consistent with your therapy at home. When spasticity is starting, meaning your arm is getting tight and stiff, your wrist and hand might start to curl up. Especially when you have moderate to severe spasticity, it is more difficult to extend or straighten your wrist and open that hand. So it is very critical to exercise and stretch your arm, your wrist, and your hand immediately. It is one of the most difficult things to manage after a stroke. So if you are ready, let's get started. The first area to stretch is your elbow. This is necessary so that you will be able to have better access to your wrist and hand. So first area that you need to mobilize and stretch will be your biceps and your brachiorad. You will see if this arm is curled up like that, these areas are very tight, the biceps and your brachiorad. So what you want to do first is to move that muscle back and forth, side to side, and massaging it. Okay, so go back and forth first for the biceps and then your brachioradialis. Okay, and then you massage it gently. All right, after you do so, after a few minutes, gently push your arm away to a straight position and be very gentle and be very patient because this will take a few minutes. If you force it, it will rebound back to a tight position. Okay, so push it forward or away from you very gently. Okay, and once you're able to do that, you put it on the table. Okay, just be very patient. Okay, and it won't hurt if you massage and move your biceps and this muscle here, which is your brachioradialis, back and forth. Go gentle. Okay, use your knuckles of your good hand to massage that area. All right, now the next area to mobilize and stretch will be your forearm. So you're going to do the forearm rolling. So you just go slow back and forth just like that on the table, keeping that stroke arm supported. Okay, so you just go rolling back and forth. All right, it might be more difficult to roll it where your palm is facing up, so just be patient and gentle. Okay, so you just go back and forth. Do this for a few minutes. Alright, so let's do it one more time. And that's your forearm rolling. After you mobilize your forearm, you can have better access to your wrist now, right? So you're just going to look for the tendons that are tight. So your wrist will be like this initially, right? Look for that area where it is very tight. Go further down or up towards your elbow. Locate the area that is tight. Massage it again with the knuckles of your good hand slowly. Okay, so I'm just showing it like that, but if you can do it on the table, do it on the table. Okay, massage it, going down towards the tendon for a few minutes. Okay, so keep massaging it. Let's do it a few more times. All right, so after a few minutes, once you feel that that area is more relaxed, start stretching that wrist towards a straighter position. So I'm going to show it again here so you can see better. Try to straighten that wrist. Do not force it because again it will rebound. Okay, so stretch very slowly. All right, stretch. So again on the table, stretch. It will take a few minutes in order to mobilize that wrist. Again, if it gets stuck, go back to massaging. All right? Then stretch again. And that is your wrist stretch. After stretching your wrist, we are now going to open your hand. Okay? So the key to opening the hand is the thumb. What you want to do is to insert your index finger and your middle finger through between the thumb and the index finger of your stroke hand. Okay? Your thumb will support the other side. Okay? Gently pull it open. And then once you are able to slightly open or separate it from the rest of the fingers, you are going to keep your index finger and your thumb on the thumb of your stroke hand. Okay? And then you're going to insert your index finger and your ring finger through. Just like this. Okay? Go slow so you are able to access the tips of your other fingers. Once you're able to do that, I'm going to put it on the edge of the table. Okay? I would recommend that you sit close to the corner of your table so you are able to hang your wrist down. This will aid in relaxing the fingers to open. Okay? So sit at the edge to the corner of your table, close to the corner of your table. Okay? Then once you're able to insert your fingers, your index finger and your middle finger and your ring finger in between those fingers of your stroke hand, relax that wrist. Okay? And let it hang. Continue to open that hand, right? Continue to open that hand the best that you can, but again, be gentle, be very gentle, be very, very patient. Okay? Once you're able to slightly open it, just like this, pull your forearm to the table until your fingers are like that. Okay? Keep the thumb open if you can. And then pull slowly. Slide your hand and your entire forearm to the table to stretch that hand and to stretch the fingers. Okay? Go very slow. Once you are there and you're able to bring your hand on the table, it might curl, right? Gently push it down. Okay? Just gently push it down. It might curl like that. Gently push down. Okay? Once it is down, rub that hand in order to re-educate and remind your brain that your stroke arm is still there. Alright? This is part of your hand rehab and to re-educate your brain that your hand is supposed to be there and it should be functioning. Okay? So just rub that back and forth, relaxing it. Okay? Hold this for a few minutes again. Be very patient with your stroke rehab, especially for your hand. This won't come very quickly. Your recovery will not come very quickly because we need to be very patient. The brain is where you have the stroke. The manifestation of the stroke is in our body. That will show up on our body through spasticity or difficulty making normal movements. Okay, so be very patient. Keep it there on the table for a few minutes. Alright, so the most critical part of your hand rehab after a stroke is how to maintain the hand in an open position so your fingers will not dig into your hand, right? So you want to get a splint. Unfortunately, I have no recommendation as to what is the best splint out in the market. But just go online, look for a splint that will keep your hand open like this and your thumb relaxed as well, like this, in this position. Okay? While waiting for the splint, what you want to do is to ask somebody to roll long socks. Okay? So you start from the bottom, at the toe part, roll it like so. Then if this is enough for you, if your hand won't open real big yet, just insert it in your hand like that, so your fingers will not dig into your hand. Now if you're able to open your hand and stretch your fingers further, get you a second sock and roll the first sock to it, and then secure it like this. So you have a bigger roll of socks that you can insert to your hand in order for you to keep a sustained stretch and to avoid the curling, the further curling of your hand into this position, which will be very difficult to open again, right, the next day. We want to have a sustained stretch so you can do these exercises again tomorrow and to the next day. All right, so those are the strategies and the techniques, the stretches that I would do if I have a patient who have a stroke hand and that is curled up like this. All right, it is always better to have somebody help you in doing these stretches, maybe your therapist, your family member, or your friends. If you have somebody to help you, share this video so that they will be able to help you better, okay? So do this daily. You cannot just do this sporadically. Do this every day, even 3 times a day. And then do this every day until you are able to feel that your hand is able to open up much better, okay? But do not stop. Remember, consistency is the key, and never give up. Until next time, paalam!